We'll continue our lecture with how harmonics and contrast agents work together. As we saw in the last lecture, harmonic imaging has two types of harmonics. We can do tissue harmonics, which we just learned about, or we can do contrast harmonics. Again, contrast harmonics are created during reflection of sound energy, and it's going to occur because of the interaction of ultrasound and microbubbles. As the ultrasound hits the microbubbles, they're going to resonate or ring, and they're going to expand and shrink during the rarefactions and compressions of the ultrasound wave, and because of that, the bubbles are going to emit a different frequency that includes harmonics. So we call this contrast harmonic imaging because we are introducing those microbubbles or that contrast agent into the body. So contrast agents, also known as microbubbles, is a gas that is trapped in a shell. Typically, they're inserted into the body either through ingestion or injected. Usually, injection through the IV is commonly how this is done. And they're going to have a different acoustic fingerprint than blood or tissue. That is why they light up and cause strong reflections that light up things that should be anechoic, like blood chambers, vessels, or other anatomical regions. Most commonly, it's used right now in echo, but it is starting to pick up some speed with looking at like liver lesions and seeing how they fill. There are 5 things that contrast agents must meet. So the 5 requirements are that it must be safe. Obviously, we can't be injecting anything that's going to kill somebody. That's kind of the opposite of what we want to happen. Secondly, it needs to be metabolically inert, so it can't interact with any of the tissues in any sort of way that's going to cause them to act differently. It just has to be a substance that goes into the body and does nothing, basically. We also need it to be long-lasting or have long persistence. The bubbles have to stay active within what we're looking at long enough so we can get pictures of it with the ultrasound machine. So there has to be some sort of setup, some sort of chemical balance that makes these last for quite a while. They also need to be a strong reflector of ultrasound. Again, if they're not a strong reflector of ultrasound, then there's really no use to them. And of course, they need to be small enough. We're really looking at where the blood is going, sometimes all the way through those capillaries, and we want to be able to see this. There are 2 different phases that we look for. We look through arterial fill and then venous fill. And so we just want to make sure that we're catching exactly how blood is flowing through an area, especially if we're looking at a liver lesion, to see and categorize kind of what we're looking at. So they do need to be small enough to fit through capillaries. There are a couple of important characteristics that kind of help out with meeting these 5 requirements. First being the outer shell material. The outer shell needs to trap the gas for an effective period of time. Again, going back to that long-lasting and long persistence. And it also has to be flexible, which leads to the small part of it, and the strong reflector, because again, as those bubbles are hit by ultrasound, they're going to expand and shrink. That causes the harmonics. So they have to be flexible to the point where they can expand and shrink. Inside the bubble, we need the gas to be stable and again, also the correct size. Being stable will let it last long enough so we can get good ultrasound pictures of it as it travels through the blood, and being the correct size helps it travel through those small capillaries. So how does it all work? Well, with the creation of contrast harmonics, first the sound is going to travel into the body. Typically we have the transducer set at a fundamental frequency. So again, that's the frequency that the transmitter is made to create. And we want to set our mechanical index at appropriate level. We'll go over in a little bit how the different mechanical indices change how the bubbles react, but we just need that set at an appropriate level. As the sound goes into the body, it's going to strike the contrast bubble. During rarefaction, the bubble is going to expand. Rarefaction is the low pressure point of the sound wave. So during that, the bubble is going to expand. During compression then, the bubble is going to shrink because that is the high pressure point. The bubbles are going to react in a nonlinear way, which we've already learned causes harmonics. And we see that nonlinear action because bubbles are going to expand more than what they shrink if we have our MI set appropriately. That harmonic frequency then is created because of that expanding and shrinking in that nonlinear fashion, and those are going to be sent back to the transducer. It's important that mechanical index is set appropriately because, again, we don't want our beam to be too strong, which may cause our bubbles to burst, and we don't want our beam to be too weak, otherwise we won't get that nonlinear reaction that we want from the bubbles. So mechanical index is a measurement of the power of the beam. We also know that it's a power measurement of the pulsar, and that's kind of where all of this energy is coming from. So we're measuring the power of the beam. It is going to depend on the frequency of the beam, and what it does is measures the amount of pressure in the rarefaction portion of the sound beam. So where the pressure is the lowest, the mechanical index is being measured. So the formula for mechanical index is the peak rarefaction pressure divided by the square root of the frequency. No, you will not be doing any math with this, just know this is how we figure out mechanical index. When we have a lower mechanical index, we're going to have a small pressure variation, and that's going to correspond with a higher frequency. If we have a high mechanical index, we're going to have a large pressure variation, and that's going to correlate with a low frequency transducer. So it'll be important to select the appropriate frequency and set the machine to the appropriate mechanical index. Be familiar with this chart as it kind of lays out low mechanical index versus kind of a mid mechanical index versus a very high mechanical index. So low mechanical index, we consider anything less than 0.1. When we're at the low mechanical index, we are not going to see any harmonics because those bubbles are going to act in a linear behavior. They're going to expand and shrink at a very predictable rate. So we are not going to get any harmonics from that. There'll be a little bit of a backscatter behind the bubbles. So again, we're not going to get clear, crisp borders from those bubbles going in. Most likely with the low mechanical index, we're going to have a high frequency sound beam, which means that the beam is in low strength, and the bubbles are really going to expand very little. So the low mechanical index does not help us with contrast harmonic imaging. Our sweet spot, though, is kind of the higher mechanical index, which is going to be a 0.1 to 1. We're going to start to see some harmonics out of this. The bubbles are going to start to resonate. They're going to act in that nonlinear behavior where they're expanding more than they're shrinking. This is going to be a little bit lower frequency of sound with a little bit higher beam strength, and those bubbles are going to expand and shrink moderately. So this is really where we want to be set, somewhere in between that 0.1 and 1.0. Contrary to that then is the highest mechanical index, and that's anything over 1. These are going to create the strongest harmonics, but the problem is that the bubbles then are going to destruct under this type of mechanical index. There's a lot of nonlinear behavior going on to the point that they're going to pop. Usually this is going to be associated with a low frequency of sound. This is going to be a very strong sound beam, and in the end the bubble ends up being destroyed. We'll watch some videos in class on contrast agents so you can see them in action. If you want to look up some videos on YouTube, I suggest you do that just to familiarize yourself with what they're doing. But in the meantime, it's time to test yourself. Number 1, which requirement of contrast agents is incorrect? A, that they're safe, B, that they're metabolically reactive, C, that they're long-lasting or have long persistence, D, that they're a strong reflector of ultrasound, or E, that they're small. Number 2, which statement is true regarding microbubble behavior? Is it A, that microbubbles shrink more than they enlarge, B, microbubbles act in a nonlinear behavior, C, microbubbles make echogenic areas anechoic, or D, microbubbles need a low mechanical index to ring at a harmonic level? And number 3, what happens to the microbubble during rarefaction? A, it shrinks, B, it expands, C, it explodes, or D, nothing.